The Psychology of Annie Wilkes by Alex Delbar and Krishna Willis.
Misery follows the story of famous writer Paul Sheldon as he wakes up in an unknown house after a near-fatal car crash. His savior, Annie Wilkes, is delighted to nurse her favorite author back to health, but things become odd as Annie's demeanor dramatically swings from caring and lively to rageful and violent. Paul is trapped in the house with broken legs, and snow-blocked roads isolate him from the outside world. Annie's obsession with Paul is revealed to be stronger than what he initially thought, making him realize the true danger he is in.
From borderline personality disorder, or BPD, which is a personality disorder characterized by unstable interpersonal relationships, self-image, and impulsivity. BPD has several symptoms that range in severity, such as frantic efforts to avoid the feeling of abandonment, unstable and intense personal relationships, identity disturbances, and self-damaging impulsivity. In America, 1.4% of the population is estimated to have this disorder, with women being nearly 75% of those afflicted. BPD is a disorder seen across many different cultures. Differences are seen in how the disorder presents. For example, in Eastern cultures such as China and India, people with BPD are more likely to overdose or poison themselves, while in Western cultures, they are more likely to mutilate their skin. Cultures such as in China discourage impulsive behavior, so that characteristic isn't as prevalent as in America. In general, people with BPD try to hide their illness due to shame and diswant to be labeled with such a stigmatized disorder. There's a stigma that people with BPD are dangerous, a burden to care for, and exhausting. This film was made in 1990 when mental health was still discouraged to be talked about and people with disorders were labeled crazy.
Frantic and impulsive things to keep Paul from leaving her. She straps him to the bed, hobbles him, and threatens suicide. Annie is seen as a very lively person, having high energy for a majority of the movie. During a rainy day, she becomes lethargic and distant, telling Paul, "You'll never know the fear of losing someone like you when you're someone like me." She then pulls out a gun and says sometimes thinking about using it, implying suicidal ideation. She is so afraid of Paul leaving her that she hobbles him, breaking both his ankles in an effort to keep him bedridden and dependent on her. Annie exhibits violent mood swings due to hyperreactivity.
Annie is incredibly reactive, going from calm to rageful in seconds. When Paul kills off Annie's favorite character, Misery, she goes into a rage saying, "You murdered my Misery," and lifting a chair above Paul as if she were about to hit him. She instead breaks the chair against the wall and lets him know that no one is coming for him because no one knows where he is. She leaves after saying, "If I die, you die." What Annie seems to be lacking in diagnosable characteristics, however, is a lack of identity. She keeps a scrapbook of horrific news depicting her previous murders, such as of her ex-husband, the former head nurse, and newborn babies at the hospital she used to work at. This memory lane book shows that she is well aware of her actions and who she is, almost seemingly proud as she collects news articles about herself and her victims. She is fine in her own company, saying, "If you can't enjoy your own company, you're not fit company for anyone else."
Psychiatric medication, intensive therapy, and long-term patient care are the best treatments for Annie. Since she has shown recurring violent acts, she would go to jail, but due to her disorder, an institute for the criminally insane will be more appropriate so that she may receive psychiatric treatment. Therapy would be immensely beneficial, specifically behavioral cognitive or mentalization-based therapy. Behavioral cognitive therapies are especially helpful because they focus on changing maladaptive behaviors into more constructive ones. Mentalization-based therapy works on differentiating the state of mind of the patient and others, as well as understanding the influence mental state has on behavior. BPD isn't curable, but it is manageable. However, due to the severity of Annie's BPD, she would require constant supervision. When, or more so if, she is deemed fit to re-enter society without being a threat to others, she can continue therapy and medications. However, there are ethical questions about long-term inpatient as they keep patients from forming relationships with people in society. Additionally, due to this film taking place in the 1990s, the psychiatric hospital conditions were most likely very poor, and Annie wouldn't have received proper care.
The film depicts severe BPD that leads to violent tendencies. It's unfair to label all people with BPD as dangerous persons, but in the film, Annie does show the dysfunctional thinking that goes with the severe end of this disorder. She displays dramatic mood swings and reactivity, a fear of abandonment so severe she is willing to physically harm people she claims to love, and shows suicidal tendencies. This film doesn't help the stigma that goes with the disorder. It could actually be harmful for people who have it and make it harder for them to seek treatment due to embarrassment and shame. The film actually villainizes those with BPD and makes it seem as if everyone with this disorder is murderous and dangerous. This isn't the case, as not everyone with BPD has violent tendencies. This movie was made in the 1990s, which needs to be taken into consideration because since then, much work has been done in an attempt to destigmatize mental health disorders.